So again, my name is Tyler Dahm, and I have a clinic in Colorado where I am a holistic health practitioner, and we do integrative medicine. And first and foremost, I'm a mom, and I have 4 children, and my 9-year-old son regressed into severe autism when he was 2, and I was a medical student in Colorado, and I saw this process happen in front of me. And I went and I started asking everybody around me, what happened? Why is he sick? Why is he not talking? Why won't he look at me? And I did not get any answers from anybody else around me. And so that started my journey right there of trying to figure out not only what was going on with him, but how can I heal him? And that led me into natural health care. And that's why we have a clinic today, is because in my opinion, there's a huge disconnect that's happening in treatment and in medicine of all forms. And we're just going to follow along in the book here because our slides are not up there, and that's no problem. But I think for me, really what it is that I spent 5 years trying to treat my son. 5 years we did the biomedical route because that was the only option for us. And we did many prescriptions and many treatments for my son. And you know what we noticed over time is that he just kept getting worse and worse every single year. And so one day I went home after our final appointment with our physician. I had let her know that I was done. I was exhausted, we were going broke, and I just didn't want to do it anymore. So I went home to my husband and I said, okay, our son is not going to be one of those miracle stories. He's not going to recover, and I've accepted that. And we're going to go forward and we're going to love him as he is. 2 days later, I got a phone call from our physician, and she said, I've got this new machine in my office. I have no idea what it does. It's some kind of ion detox, and I want you to come in and at least just try it. So I did. I threw that penny in that last wishing well, and I went down there, and we started detoxifying him through Ion Detox. And what I noticed immediately is that he had more focus. He was looking at me in my eyes, and I hadn't seen that for about 5 years. So that was really important for me. But again, I'm a scientist above all things, and so I wasn't convinced that that's what was going on. I did buy the machine and take it home with me, and I started detoxing him. 2 weeks later, my son toilet trained. Once again, I thought, this is a fluke, that's not what's happening. 4 weeks later, he started having words. Within 4 months, my son was speaking conversational sentences. The only thing that we were doing at that point was detoxifying him ionically. And so I started diving into this and I started researching it. And what I realized is that I came to this profound epiphany as I was praying on this one day. And it was, we are doing this backwards. Every single thing I did to my son was because I was trying to fix him. I was in this rush to make him better. But what I realized is that our children, and even if it's a patient, anybody that has chronic illness, that patient is a house. And that house is now burnt to the ground when we have chronic illness. And what we're doing is we're so quick to go in and put all of these things into the body and rush to rebuild. We haven't taken a step back to do 2 critical things. And that's to identify the source of the fire and then clear away the rubble. We have to do those things first in that order in order for any other treatment to really take hold and create change in the body. Once I realized that, I stopped everything we were doing. I detoxed my son, only using Ion Detoxification for him for 8 months. And I really am excited to tell you that my son is recovered. So now, I want to also tell you that we did the detoxification first for 8 months with nothing else. And we did go in and then treat his underlying issues, because now that I wasn't throwing all of these things at his body, we could see what those were. And for him, it was very clear high viral markers. He had pathogens. He had one marker for Babesia in his blood that we were able to find. And he had significant genetic issues, epigenetic issues. And so I'm just going to talk a little bit about that with you, about how this process works. And so to really understand the process of ion detoxification, we need to talk about the autonomic nervous system. I'm acutely aware that you guys are very familiar with this system here at this training, which is going to make my job easier. So anytime that our patients have these infections, these underlying causes, whether it's bacterial, viral, fungal, if toxicity is the root of the nature, if we have heavy metals, if we have chemical exposures, we are creating a stress response in the body. We're activating that sympathetic nervous system. And those responses were always meant to be temporary, but especially in our patients that are so compromised, that becomes a permanent state of fight, flight, and freeze mode for them. And they no longer are able to facilitate swinging back to parasympathetic. When we can't go back to parasympathetic nervous system, we start to find compromises, not only in those hormone responses, cardiac responses, the neuroaffective responses, but now, as you guys are seeing in your practice, we have issues in metabolic, we have issues in detoxification, and we now have massive inflammatory responses that we're managing. So if we have chronic states of stress that we can't get these patients back to the innate system of parasympathetic, what do we do? How do we manage that? We have impaired communication in the transport systems. We're trying so hard to get this nutrition in for them, and they can't utilize it properly. We're trying to get treatment into them. They cannot move it through. And that's a huge issue for us as far as how can we get the best outcomes. One of the systems that is most compromised that I have seen in my research using ion detoxification are the voltage-gated ion channels. These systems are in every single thing that we do cellularly. They regulate our ability to do sodium ion channels, potassium, calcium ion channels. They are the part of active and passive transport. It's sort of that firing mechanism for those things. And there are action potentials. We require those processes to work every single second of every single day that our body is living, and toxicity and underlying infections go in and shut those down. And those voltage communication, that electrical system that we're talking about, that we're working in the body, it's not functioning anymore. It's not effective. We can't do those things. And so that turns into something called a channelopathy. When we have a channelopathy inside the body, it causes actually several systemic issues. One of them is epigenetic mutations. How many of you guys do genetic testing in your practice, or at least you're getting familiar with those mutations? Okay, good. That's really good because that's going to be important. Environmental and chemical sensitivities. Those are an underlying issue with a channelopathy. Nutritional deficiencies come into play. Hydration issues come into play. We've got impaired detoxification, as you all are seeing, and we have impaired immune cell function. All of these things sort of are the catalyst for a channelopathy inside the body that's no longer at an energetic level to regulate homeostasis. Some of these epigenetic mutations that I see over and over in my practice, although there are several that I work inside of, the main ones that I see are MTHFR and MAOA, CYP, CBS, NAT, and SOD. When we have these mutations, as you can see, we've got issues in methylation, we've got issues in metabolic, we've got issues in transport, and we've got issues in detox. Every single one of these mutations will pair with another mutation and create a system that is shutting down our goals of treatment in the body. If we can't methylate, well, then we can't detoxify. If we can't metabolically support our systems, then we can't utilize our nutrition. If we can't transport anything through, then again, what we're going to see is we're going to put all of these things into the body, and it's going to create a stacking effect. And instead of getting the outcomes that we're looking for in healing, we're actually going to get the opposite, like we touched on Herxheimer reactions. When you start to have a patient crashing and you're doing all of this treatment, it could be because their transport system is compromised. And even though you think you're supporting that, it's not moving through where it needs to go for utilization. So that's going to create a whole other catalyst of issues over here. And so how do we work around these things? We've got environmental chemical sensitivities in our patients. Every single time they go out into the world around them, they're surrounded by the chemical revolution. There isn't any one thing that we come into contact at any point in the day that hasn't been some sort of chemical process or some sort of toxic relationship. If we have multiple chemical sensitivities in our patients, where do they go when they have to go out and navigate the world, but they have these reactions to deal with after that exposure? And nutritional deficiencies. I could spend hours talking about that, and I'm sure you're all familiar with it, but it really is a big issue for our patients. If we're giving them clean and safe and valuable nutrition, but they can't utilize it properly, what do we do? It becomes a real issue in treatment. Detoxification methods. There's many, many ways that we can detoxify. We've got oral chelation, IV chelation. drops, binding agents. We've got specific organ cleanses. And, we do now have ion detoxification. But up until then, all of these detoxification methods that we're doing require one thing, and that's for us to put something into the body. Now, this creates a threefold issue for patients that have transport compromises. If you have blocked pathways and blocked receptors and you continue to put something in, again, it goes back to creating that log jam of treatment. It's not going to be effective for every patient. No one thing will ever be effective for every patient, but if they can't move it through, then we're really creating another issue. And then going back to those Herx reactions, we're just going to see them continually crash, and we don't have an answer to solve that. And really what it does at that point is it creates a vicious cycle that we're trying to fight. We've got the onset of infection, causes epigenetic changes, which then go in and actually impair our detox further. We've got the nutritional deficiency stacking on top of impaired immune function. And all of this sort of sets the stage for chronic catastrophic illness. So why is ion detoxification so different? How can this tool help utilize healing in a body, help facilitate detoxification, and change your patient outcomes? What I learned is that when it's done properly, what we're doing is creating a frequency that's harmonious to the body so that we can elicit a relaxation response. The goal of that is then to activate the parasympathetic nervous system and create rest and digest. Rest and digest is the body's innate process to be able to open up those pathways and release everything that the body can't utilize, whether that's toxicity or if it's built up nutrition that was meant to help us, but now we can't use it. That's the system that we use to move those things back out of the body and create homeostasis. So the purpose of ion detoxification is to facilitate that as an external proxy where the body is compromised and cannot do it on its own, even when you've already done other internal interventions that are not working. So, and that's really what it is. It's quite simple. It's when you think about in terms of being able to access these frequencies that help our body come back into balance. We're looking for grounding. We're looking for being able to create homeostasis in a way that we can't do on our own anymore. This is what it's doing. And so I think what I've seen in my clinic is quite profound. Patients that are the ones that are non-responders are often the ones that respond the best to ion detoxification. And we'll often start with them a little low and slow because especially if they have a Lyme history, they can be quite sensitive to the detox. Once those pathways start opening up, it sort of creates a floodgate system. And a lot of people talk about, okay, what's going on in the water? Is that really detox? It is. Part of it is detoxification. 70% of what we see in the water is actually coming from the body. It's releasing of organic acids. There's glucose in there, creatinine in there, anything that the body deems needs to be flushed out. We will see that in the water through labs we've done with doctors' data. We'll also see heavy metal exposure being excreted through the body this way. And so it's really important tool for us. But it also does something, the true magic of it is that it's creating detoxification systemically. Once we activate rest and digest and we're working inside the natural system of the body, all the organ systems have the potential to become detoxifying. So what we don't see in the water is okay because the colon may be cleansing, the liver may be cleansing, the blood system may be cleansing, maybe the respiratory system is now being activated. These things that we don't necessarily measure in the water, we know are occurring inside the body. We do baseline labs at my clinic that tell us where the metals are and where the organic acids are, and then we cleanse for 4 to 6 months with that patient and retest them. And I can tell you, we are seeing clinically significant results just using this tool. So it's definitely an effective answer for those that cannot facilitate these processes on their own. One thing that I have also noticed is that over time, we'll need to do less and less sessions as the body relearns its natural process to activate parasympathetic nervous system on its own. It is a tool that is a lifestyle thing that everybody in their home should have. I really feel this way given the nature of our exposure daily. But the real miracle of it is that it's actually helping the body get back to that natural state without having to do any other unnatural interventions. So that's a beautiful thing for us. And I'll talk quickly about one of the studies that we did using 25 children on the autism spectrum that were in my practice and that I was connected with. We sent machines out to them, and we gave them a very specific cleansing schedule to do for a 4-month period. We started by using something called the Autism Treatment Evaluation Checklist. This is a scoring system that practitioners and parents will use in order to evaluate the effectiveness of any intervention that we're doing for that child at that time. The higher the score, the more severely they are affected by autism, and the lower the score, the more that indicates to us that their symptoms are getting better and that the intervention is working. As we got started, we tested them every single month just using Ion Detoxification. Every month they had to submit an ATEX score back to us so we could track it. And what we found overall after the 4-month period of cleansing children ages 2 up to age 20 was that after 4 months they had a 55% reduction in that ATEX score. I was astounded, and we sent 2 different study datas over to a data analysis, and it came back that this is a repeated measures analysis that is clinically significant. This does matter. 55% reduction, I've never seen that in any one intervention I've done previously in my practice. And the fact that it's working on our older children that have been labeled as non-responders tells us that we're onto something pretty profound here. So I think that we have a lot more research we need to do in this area, but I can tell you that patients who didn't have any hope before, who've done every intervention, they've gone to every practitioner they can think of, they've tried all of these tools, and they can't seem to facilitate that healing, and then they begin using an ion detoxification system that works inside the energetic pathways of their body, that helps work with the natural system that it was given at birth and help facilitate that. The outcomes that we're seeing in the clinic are very significant. These patients are finally starting to feel better. And when they feel better, that treatment that we're doing with them that wasn't as powerful or wasn't as effective before, once those pathways are open and clear, all of a sudden that treatment actually does become effective for them, because now their body can utilize those things that we're giving them effectively where it couldn't previously. And really that's the crux of it. I'm going to open it up for questions, and I'm going to have Neil Maroney actually come up here with me as well. I am here with the Ion Cleanse by AMD, which is the product that I use in my practice. I have 5 machines in my clinic and 1 at my house. And so he's going to answer questions for the technical side of it that I may not know about the machine itself, and then I can answer any questions from the clinician side of it. Yes?
What's the schedule that you're using?
Well, I'll be honest with you. I was told that there's a recommendation that you've set forward, but my schedule is different. The children that I work with on the autism spectrum, what we found by doing 2 different studies with them is that cleansing them 3 days on, 1 day off, anywhere from 20 minutes to 45 minutes, depending on their need and what I found in their medical history, that seemed to be the schedule where we got the 55% reduction in ATEX scores. Some of them started out lower and slower, and it actually didn't work as well for them. So we took them up, and that's what we found.
Did you publish the study already, or is it so far just data collection?
It's data collection, and we did do the repeated measures analysis that we have on a white paper, and that's actually available at the booth for anybody who wants to look at it. And I believe that Neil is looking at doing an IRB approval so that we can do some actual clinical studies and really have that data behind us.
I think you should look at my data that I have. We did the study on 20 patients looking at how much they're excreting in the urine afterwards and in the hair, and that was very dramatic. But we combined it with cilantro because we showed that amplifies the effect. So it's like I'd like to go over that with you because it's I mentioned to the group here that it has become our preferred method of detox, and it is very significant, but it can be even improved with a few other tricks and actually looking at not what's in the water, but actually what comes out in the next few weeks in the urine and in the poop and in the hair and in the skin is very, very dramatic, and it makes it, the stuff that comes out in the water, minuscule, ridiculously small, but the other stuff is dramatic, and we're the only people that actually looked at that, and so I would love, we have the raw data. We need somebody actually to put the effort in to publish it, so maybe we can team up on that.
That would be amazing, because I think what you said is exactly right. What we see in the water is just really a minimal portion of it, and in fact, to me, it's clinically insignificant compared to what we see systemically happening in the body. So that would be wonderful. Yeah, thank you. Yes.
I ran the biggest Detox centre in London for many, many years, and for those of you who don't know this, I can absolutely tell you everything these guys are saying is absolutely spot on. I did it for years, and the results we had were absolutely astounding. For the benefit of everybody here, could you explain to people what happens, or when somebody comes in and the water's beautifully clear?
Yes, that's a really good question. Thank you. Somebody comes in and they sit down and we don't see any changes in the water. There's two things that are going on there. I work with a few patients that have an addiction history. And this is something that the machine is really great with. It's sort of off topic what we're doing here, but this occurs for a couple of reasons. One is that the opioid response in their brain is very profound, and they have an addiction connection that's going on that prevents them from releasing any of these toxins. They're holding on to everything. They're sort of stuck in that fight, flight, and freeze mode. And then the other thing that's occurring is that the medications, or drugs, if you will, and this can happen with patients that are actually on pharmaceutical medications. This is not just a street drug issue, is that the levels of medication in their body are so high, it creates a systemic issue of ammonia. Very, very, very high concentrations of ammonia, and what we'll see is that the water is white, and it's often sort of like a bleaching effect that occurs from what the medications and chemicals are doing inside the body to the organic acids that are existing there. And it's a really profound sort of experience to see it. I almost didn't believe it myself, but it's, yeah, oh, and you're right, you can smell it. It's, the smells are a little interesting. Sometimes it smells like rotten meat. Sometimes it smells like chlorine. Sometimes it smells sugary. And so there's definitely, you can correlate what you're seeing and smelling in the water to what you know about your patient's history. It's very interesting at the end of the day. Yes?
Are you giving them mineral supplements? Any of the minerals come out of these that need to be replaced?
That's a great question. Let's talk about minerals for a minute. There is a very big misconception in the community about Ion Detox being able to go in and pull minerals out of the body. Really, that's not how it works. What it does is that if the body has excess levels of minerals that it can't utilize, again, going back to transport issues or underlying deficiencies, if we've given minerals and they're sitting over here in the waiting room, but they never made it through the body to utilization, we will detox minerals because the body can't use them. So it's going to release anything that it doesn't have a purpose for. Now, having said that, I do recommend doing mineral supplementation during any form of detox, because our body requires excessive amounts of ATP in order to facilitate detoxification. In order for us to then replenish that ATP, we're going to use higher levels of magnesium and zinc. Not every person that does detox does mineral supplementation, and I haven't seen any issues with that. If you are working with children specifically, I do recommend that you do some kind of mineral supplementation, and they should already be on that as it is in order to help facilitate ATP production for healing. Yes?
Does the quality of the water matter? I mean, whether it has fluoride or not, or can you do it with regular tap water regardless of the fact of it being filtered or not?
Yeah, so preferably tap water is better because it has that nice concentration of toxins and minerals and chemicals in it. And so, you have to think about it in terms of law of attraction. We're trying to draw these similar charges out, and so I think that's best. However, I'll tell you, many of our patients take our advice. They have filters on their house. They have RO water. They're getting clean sourced water. And so they'll use that, and it will require more salt in order to do the conduction, but it will work effectively. Yes?
Yeah, does it matter what salts you use?
It really doesn't matter, but I mean, if you're going to be soaking your feet in something, even though the machine creates a one-way valve as far as output through that electrical response that we're doing, I still probably wouldn't use iodized salt. I wouldn't really want to soak my feet in that, but I use regular sea salt, and the machine comes with a bottle of real salt that's mined out of Salt Lake City, and some people just use Himalayan salt that they buy at Costco. So really, you can do anything. Yes?
If
Yeah, that's a great question. Side effects. Well, of course, detox always comes with the chance that you're going to have a Herxheimer reaction. What that looks like in patients is mostly just increased lethargy. They might be more tired. They might be a little bit more aggravated or short-tempered, and they may have some headache. What I recommend, the timing is going to be different for every patient that you work with. And exactly, she's giving me hand signals over there, which is great. But hydration is key. And it's not just hydration, it's also electrolytes. We've got to make sure that those things are in balance in the body, because our kids or any patient that has hydration issues, you've got to make sure those fluids are in there. That's going to help flush those toxins out of the body as well. Once we've activated this relaxation response and we've opened everything up, if we don't have the appropriate amount of fluids to then help flush that out through the body over the next 48 hours that this response is going to be active, then you're definitely going to feel it. But every patient is going to have a different level of cleansing. We've got some kids that they can do 3 days on, 1 day off, and that works for them. That's how they get better and they move those toxins through. And then I've got kids that I would never do that with. I've got a couple of kids that do 15-minute sessions every 3 days, and that's what they can tolerate. And the trick is to find those patients and start to identify those patterns, and so that you understand which kids need less and which kids need more. And this is why I work with practitioners all over the world, helping educate them on this technology, as well as helping them spot those patterns and look for things in the medical history that can give you identifying markers on how to set cleansing schedules in your own practices. And I do that for anybody that has a machine. Yes?
So there are a whole bunch of different Ion machines out there.
Yeah.
I should say, well, can I just go and get, X, Y, Z?
And the answer is no. You can't, and here's why. To be completely honest with you. I have used other machines before in my practice, and I used one with my son. And what happened was the array plate would tip over and an alarm would go off on the machine, and then the woman came running into the room. And my son almost didn't do Ion Detox again after that because he was terrified. And so was I, because I thought, I just put my kid's feet in the water and I have no idea what I'm doing. I didn't even realize that this could have a risk potential here. And so it got me thinking about the differences between machines and how do we know that these are safe. The only machine, when I did my research and I was looking at, I think, about 8 different models that were being used in clinical practice, is that this particular company, which is why I paired with them, is Ion Cleanse by AMD, which is a major difference. When Dr. Maroney was developing this technology, he specifically tested the current that's going to be running through that machine and then be exposed to the water where patients are putting their body. And what he found when he was testing other machines is that they had EMF response, they had stress current that was creating, it was creating a stress response in the body because the current wasn't filtered. Do you want to explain that maybe a little more?
Yeah, so the output of the machine is very important, and it's a very sensitive process. So since our bodies are obviously electrical, you want to make sure that the current running into the water is a very clean filtered current. So exposure to EMFs, AC flow through, leakage current, hazardous voltage current. These are all things that can be measured pretty easily, but we got to make sure that we filter them out and only get the clean current into the body. That's what elicits the relaxation response. Otherwise, you're throwing the body into a stress response, and at that point, you could just be coloring the water, because the water will change color with or without feet. So it's the idea of getting the body into that relaxation response so it can start to detox. Otherwise, you're throwing the body into stress responses, and you're not filtering out that current.
Exactly, and that's one part of it. That's only one part of it. When I was looking at the other machines, there was no safety measures done. Most of these machines are made in countries where there isn't any safety regulation for mixing electricity and water. This machine specifically uses a medical grade parts and a medical grade power supply. If I'm going to put my child's feet in there and I'm going to put my patient's feet in there, I want to make sure that we're using the top quality materials. Even everything down to the steel that's being used in the array plate is medical grade stainless steel. So that's really important to me, and I've yet to find a machine that has all of those things. Also, when Dr. Maroney was developing it, he did something that called it Maroney proof. And the reason he did this is for his sweet wife, Barbara, who I really love. She has literally dropped the machine in the water 2 times while she was cleansing, the actual machine, and she's fine. The first machine did not survive. The machine died. So But the second machine, they just put a new computer chip in it and got it going, and it was working just fine. When you are mixing electricity and water and you have a patient with you, especially if you're working with children and they can be, very spastic in their movements, as you know, some of our children have tic issues. If they're going to knock that machine into the water, I need to know 100% that they're not going to be harmed. So this is why I use the machine that I use and why I think it's well above any other machine that you could get for $300 on Amazon. Yes?
Did you do any testing of heavy metals before and after?
I do those testing in my clinic. So anytime that I have a new client or a new patient come in, I do baseline testing. So I test for metals, I test for organic acids, and I do pathogenic testing as well. And then my process specifically is that I don't do any other treatment for around 4 to 6 months, depending on what I'm dealing with a patient. And we only focus on detoxification. And then I'll run those labs again at month 4 or month 6, and that's when I can tell the metals are going down, the organic acids are coming back into balance, and we're starting to see homeostasis take place. And that's how I know when they're appropriate to then go in and do further treatment, that their body has been primed and ready to accept that. Yes?
Do you have a treatment regimen for patients being treated with Lyme disease and also just for general populations or with detox?
As far as my treatment regimen, as far as detoxification or?
Using the foot bath.
Oh,
Yeah, for
well,
Lyme-
yeah.
For Lyme patients and also for just regular normal people that have.
So here's the thing. This is my philosophy as far as me specifically in my practice. Maybe not every person has a Lyme diagnosis. I have yet to see one single patient come into my clinic that doesn't have bands that are positive or high viral co-infections or some kind of pathogenic issue. We've got the 4 underlying things that I see across the board are bacterial, viral, fungal, and toxicity, whether that's metals or chemical exposure. So I don't treat any patient as if they are their diagnosis. I don't even actually, to be honest with you, I don't really believe in diagnosis. I believe that we're all systemically, chronically infected with these things that we've been introduced to. And so I treat them similar until when it comes to detox, depending on, obviously the detox schedule is going to be different, but across the board, I'm still going to be treating them for all the underlying issues. It just really depends on how those underlying issues manifest in their symptomology specifically, and then that's where the treatment plan deviates. But my practice is to do detox first before we do anything else. We're identifying the source of that fire by getting those tests back and telling me what I'm working with, and then we're going to clear away the rubble. Sometimes that detoxification coincides with doing an antiviral protocol. Sometimes it's a Lyme protocol. Sometimes it's a chelation protocol. We're going to do metal clearing. But either way, detox and clearing is where we start, and we don't do anything else. I don't support methylation. I don't support metabolic. I don't do any of that until all of those things have been cleared away first, and the body is in a state where it can then accept nutrition and then accept therapy from there. Does that make sense? I hope that answered your question. Okay. Yes?
If the patient is severely dehydrated, is that going to cause a really bad first reaction? Do you have to really
Yes.
fix that first before, and mineral deficient, sometimes people, when they're really sick, that's kind of where they're at.
Yeah, and here's the thing. This is a chicken and the egg question, because dehydration, it may not because they're not intaking enough fluids. It could be because they're very compromised in their transport system and we're not actually getting the water where we need it to go in the body. This is why we see so many patients that have these chronic constipation issues, because they can't move those fluid in where they need it to go. So, do you wait until hydration gets to a point where they can tolerate detox, or is detox the thing that they need in order to then be able to facilitate that hydration to be effective? So that's the question. I always just start with detox and make sure that they understand how to support their hydration, whether that's things above water, talking about doing the electrolyte drink. I always give them a recipe for a natural electrolyte drink. We do lots of things like aloe and coconut water and other things that will help support that, as well as doing Sol. I don't know if Sole, if you've heard of that. It's just a salt electrolyte thing that we do for patients in our clinic. But hydration issues absolutely need to be addressed. And anytime you're doing any form of detoxification, they've got to make sure that their fluid intake is at an appropriate level, or they are going to feel sick. And we don't want anybody to feel sick. My goal is never to have a Herxheimer reaction. That's something I try to avoid at all costs. If I can keep a patient right below that threshold, then I'm doing a really good job. But there are times where it's unavoidable, unfortunately. Yes?
Without giving proprietary information out, can you comment on the frequencies that are in there, or?
Unfortunately, no. That is part of the proprietary piece, is to make sure that everything gets filtered out.
Is it a DC current? Is it AC? Is it?
No AC, no AC. So it's direct current, and then there's other things to make sure. You can have direct current with AC flow through on top of it. You can have leakage current. So it's a matter of filtering all that out. That's part of our process.
In terms of the voltage that's going through, it must be a low voltage.
Yeah. You're looking. I mean, the machine tells you it's about 20 volts at 2.5 amps. Yeah.
Can you talk more
Yes.
about the different modes of the machine?
Oh, sure. So the machine has it's a dual polarity system. So the machine the home unit has a 70-30 ratio. So 70% of the time is producing negative ions, 30% of the time is producing positive. The professional model has four other modes that will have different ratios of positive to negative ions. And if you do muscle testing or pH testing of some sort, you can modulate the modes for that particular person at that time.
I will tell you that I have both the Premier machines and the Solo machine, so I have two different kinds. I'll be honest with you, I have no idea how to use the other settings. I just keep it on the standard detox setting, and it works very well for what I do. But I know some other practitioners that are trained in that muscle testing, and if that's an interest that you guys have, if you're bringing this technology into your practice and you want to learn how to do that testing, that is available. There's some people that you can reach out to that will tell you how to do that.
Well, in the instructional video has a whole section on muscle testing with the programs too.
Even better. Okay. Yes.
This is a physician-only type of product, and what is the expense of the, I guess, I'm under the impression of it is two models?
Yes.
Yeah. So it's not a medical device, so it's not physician only. Anyone can purchase it. You don't need a prescription. We try our best not to make any medical claims, which is why I have my practitioners do most of the talking. There's a lot of things that we just can't share as a company. In terms of cost, we have the home units about $2,000 and the professionals about $2,900.
And I recommend, honestly, to my patients that they have a unit in their home. It's not about generating sales or referrals, although there is a program for that to help supplement income for practitioners that are starving. But it really, for me, what it is it's about the cleansing schedule can get intense for some patients depending on what their need is. If they have the unit in their home, what's more important to happen is that they're going to start using it for themselves as well. They're going to heal their child, or they're going to heal their spouse or themselves that's sick, and then that's going to generate over into everybody else in the family. They're going to start asking questions. Oh, I wonder if this will work for this issue that I have, or maybe that will help my neighbor or my friend. And then what happens is profound healing starts to occur throughout the entire home, and the energetic level that's going on. If you heal yourself, you can heal your child. That's sort of the motto that we use in autism, and that works for everybody in the family. So I really encourage patients to have one in their home to use it for everybody, because again, like I said, we're in the middle of the chemical revolution. We live in toxic soup. I can't imagine any time when we're not going to have these chronic exposures, and you don't want to run back to the clinic every single time to do a session. So it's better for them to have it in their house. But I do lots of sessions in my practice as well, and it's been very effective.
How often do you have to replace the coil part?
Yeah, good question. So the element that goes in the water, we call that the array, and it lasts an average of about 30 to 40 adult sessions. It comes out to about 1,000 minutes, and the cost for that is $70 for an individual set, or you can get them in bulk for $55. So cost per session is anywhere from $1.50 to $2 per session ongoing.
And I do 30-minute sessions in my clinic itself, and the cost on that is $45. So obviously it's, for business-wise, it's good for that. I don't really have an issue with the plate replacement. We buy them in bulk, and it's been very affordable for us. Do you guys have any other questions? Okay.
I know you work a lot with children.
I do.
I was just wondering if you have any feedback on older people, like with Alzheimer's and, dementia, Parkinson's or anything like that, those
Yeah.
kind of issues.
I'll say that we've been doing this since 2002, and the autism, our entry into the autism community is about 1.5 years now. So prior to that, we were servicing the adult market. So Alzheimer's, if you catch it early enough, a detox program we think can be very beneficial. Fibromyalgia, gout, there's so many issues that have a toxic component as an underlying cause. So the adult market has brought us to this point, and that's kind of been our bread and butter. Yeah, adults do absolutely wonderful with this technology.
I'd like to just add something, so thank you very, very much.
Thank you so much.
Just some additional thoughts on this. I mean, you heard me talking sort of that in our clinic or in my life, it has emerged as the most powerful technique, but by actually giving, because we did some real research on it, you know, that we never got to publish with the German neurologist, and we showed that the excretion of toxic metals goes dramatically up after a treatment, but the peak of metal excretion from the kidneys is at day 3 after one single 30-minute session. And so with the very sick patients, we do recommend to only do it every 3 or 4 days to not overload the pathways, you know, downstream. And this is from my own experience, but also from the literature, to protect the blood. You know, when metals go in reverse and come out, they can cause oxidative damage to the kidneys, to elements in the blood. And it's vitamin E and garlic that are protective of that. You know, so our treatment using the Ionic Foot bath is to do the 2 pipettes of cilantro 3 times a day, always half an hour before the meals for added benefits, and go quite high with the vitamin E and the garlic. And the most important day for that is day 3 after the Ionic Foot bath, you know, when the things run through. And that becomes even more smooth, you know, with that. And the Ionic Foot bath, in my teaching in Germany, has replaced EDTA chelation therapy, has replaced to work with DMPS, has replaced all of glutathione and all of D-penicillamine and all the other things that we were using. So there is one exception to that, is that metals tend to compartmentalize in certain areas. You know, it may sit in the sphenopalatine ganglion, it may sit in the jawbone, it may sit in the pelvic floor. And with muscle testing, we find that, and then we use DMPS mixed with procaine in various proportions and inject it straight into those areas. And the patient goes immediately to have the foot bath afterwards, and all hell breaks loose, you know, when you do that, but in a good way, you know. So this is just for the medical practitioners here, that you can speed up things by poking a needle into the nests of metal accumulation and using selective mobilizing agents to put that in there. But I do know that we're facing a revolution here, you know, that by combining, instead of relying on biochemistry, to rely on physics rather than biochemistry to mobilize things. And metals, of course, you know, metals are conductive, and metals and electricity always went well together. That's why metals end up in the nervous system, because the nervous system is an electric conductive system. And so by using electricity, we're selectively mobilizing metals. And in our research, we showed that the relationship is about 10-to-1 for each toxic metal that we're mobilizing. We only mobilize 1 healthy metals. But there is that issue, and we use from BioPure, the liquid electrolyte is a fantastic tool to enhance the metal excretion dramatically. You know, so that's the other tool that we use, that we talked about on day 1, about the special electrolyte is produced in a totally different way than other things. Lilias.
One of the other things you'll find is that if you have any chemo patients, if you get them to put their feet in one of these things, after about 4 or 5 days after chemo, they don't tend to lose their hair or their eyebrows. It's phenomenal for getting the residues of chemo out of people's systems, and they don't have all of the nasty side effects afterwards. Yeah. Well, no, in between, when it's safe for them to put them, I mean, teacher will probably give us more information on that, but it's phenomenal for
Yeah, well, we know we're also mobilizing all sorts of other crap that we don't have the money to measure, but the study that we did was on 20 metals, and it was very dramatic. And it was a surprise to all of us, that we spent $20,000 on that, of my money, and then never published it. We have the raw data on it. I like to just end, before we take a little break, on a little bit of physics on this that you guys may not know. I struck up a friendship with Professor Pollack. Pollack wrote a wonderful book called The Fourth Phase of Water. And basically what that is, I can explain it. He's a professor at the UW in Seattle. And basically what he demonstrated is that water has a self-organizing tendency. If you stick any membrane in water, water itself creates a slime layer on the membrane and organizes the water molecules so that they're polarized, so that if you put two electrodes on it, one on the outside of the smear layer, one on the inside, you get 70 millivolts. And he actually proved that the whole idea with the ion channels, the sodium-potassium channel, is gone. It was wrong. Any membrane on the cell wall will self-organize the water so that there is 70 millivolts on it. He just did that by sticking plastic foils in water and putting electrodes on it, and showed the 70 millivolts. It doesn't require ATP or sodium-potassium pumps or so. But what he also did, I talked to him. I spent actually a very expensive dinner with him to hear him out on it. He's actually tried the Ionic Foot bath and actually demonstrated that immediately when you stick the feet in the water, all the membranes in the body that have lost their charge, have lost the polarization of the water molecules, immediately self-organize as an effect of physics that really cannot be explained by current physiology or current physics. It's just an effect that can be observed, but cannot be understood by current measures. That what you say about the channelopathy is totally true, but the effect is actually not understood. Why, when you stick the feet in that water, suddenly in the brain and everywhere in the body, all the membranes orient themselves and get their 70 millivolts back, and the water molecules straighten out, so as if they're given new marching orders. I recommend you all read that book. It's called The Fourth Phase of Water. It's one of the most valuable, precious, important books of our time to read. And I do believe that in that book is the secrets why the foot bath works and why it has superseded all the other detox methods.